Sir, 1 minute, 1 minute.
Sir, 1 minute.
Good evening, sir. A very good evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness that can be avoided once epidemiologically vaccinated. This is an initiative from Cadila through its innovation to serve the society and humankind. The topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccines. Dear doctors, rabies is the world's first novel 3-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded, and no case of ADRs was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. A.S. Dixit sir, MD Medicine, practicing in Sri City Hospital, Rajnandgaon, having more than 50 years of experience. Now, I would like to request Dr. A.S. Dixit sir to initiate the talk, and later on, we will have a question answer session. All the participants can drop their question in the chat box, and we will read out the question after the presentation. Hand over to Dixit sir. Thank you, sir.
Friends, welcome. Good afternoon. Today we are discussing about the new 3-dose vaccine rabies. But before this, let us have a little discussion about rabies. Rabies is a viral disease causing encephalitis in human being and animal after a bite from the rabid dog or other animal. The history of rabies is very old. Rabies is known around 2000 years BC. The first written record is available in Mesopotamia about 1830 years BC. 1930 years BC, which dictates that owner of a dog should showing symptoms of rabies should take preventive measures against the bite by the dog. Means if the dog is showing symptoms of rabies, the owner should prevent himself from the dog bite. This is 1930 BC. Louis Pasteur, at the age of 55 to 65, first described the disease and found it that it is caused by microorganism. And he prepared vaccine for it also, about which I am going to tell you later on. The biggest outbreak of rabies in 1981, when more than 7,000 to 8,000 cases were recorded. Rabies is named after a Greek word, lysa. Lysa means inner madness. And that's why the name of the disease virus is given Lysa virus, and name of the disease is Lysa. Rabies has very high incidence in India. There is no actual record. It is said that between 20 to 50,000 deaths occur in India every year, and mostly in the village area because of lack of knowledge and proper treatment. While India has highest number of cases, there are certain countries who are rabies free. Australia, New Zealand, Japan, Taiwan, Hong Kong, Singapore, Fiji, UK, Ireland, Norway, Sweden, Jamaica, and Barbados are rabies-free. In India, there are also rabies-free area, that is Andaman, Nicobar, and Lakshadweep Island. It is a rhabdovirus called a filtrate neurotopic virus. And human beings are infected not only with the bite of a dog, but when a dog is licking, or when a dog is touching with the claws, that is because he always touches his claws with his tongue, it is also infected. I'm not going into the pathology detail of this disease, but one thing that must know that this virus enters through dorsal, to the skin, to the dorsal root ganglion, where it multiplies. From dorsal root ganglion, it goes to the brain, and brain, there is several time multiplication of the virus, and from there it goes by efferent nerves to the whole body, and even the saliva is also having viruses. The death is very high. The rabies is not caused by rabies dog, but it can also be caused by cat and certain wild animal like wolf, jackal, and potex. And in Latin American countries, the disease is caused by bat, chamgada. In USA, vampire bat is responsible for this rabies disease. Rabies can cause the disease overall by 90% dog bite. So 90%, we should say 90% cases of rabies are due to dog bite. And there are two types of clinical picture. One is encephalitic type, where you get a hydrocephalus type of picture. And second is paralytic type, where you get a Guillain-Barré type of picture. A detailed pathology is not, detailed clinical symptoms are not needed to be discussed. Diagnosis can be made by clinical examination, antigen, Negri body examination, and other examinations. The treatment is symptomatic. Oxygen, IV fluids, diazepam, largactil, etc. are given. Only there are 15 survival in the whole world from rabies. And it is said that a special Milwaukee protocol has been used in these cases, in which they use lot of psychogenetic drugs, barbiturates, diazepam, and they produce an artificial coma in which these patients remain and they recover. But there are only 15 is recovery, and with partial neurological damage, and 3 of them were Indian. About the prophylaxis, most important, before we go for the vaccine section, which is very, very important, we must know little about prophylaxis of rabies. Immediately after the dog bite, we need the prophylaxis, and it is given by immunoglobulins. It may be human rabies immunoglobulin, it may be equine rabies immunoglobulin, or it may be antibodies. So monoclonal antibodies is on the top because it enters the blood-brain barrier, whereas HRIG and ERIG, they do not enter the blood-brain barrier. So we should prefer monoclonal antibody, which is available as rabies shield, and 20 units per kilogram has to be given according to weight of the person, and 50% of this has to be injected locally at the site of bite, and 50% has to be injected on other side of the limbs, not on the same limb, other limbs. And this should be done by a separate syringe. This is the passive immunization. Either you give rabies shield or you give human rabies immunoglobulin or equine rabies immunoglobulin. Equine rabies immunoglobulin can produce toxic reaction also. So it is almost not used. Now coming to the active immunization, 5 doses of 1 milliliter of cell vaccine are used. They may be human diploid cell vaccine, they may be chick embryo vaccine, they may be varicella vaccine, they may be duck embryo vaccine. They are being used for this. And one is given intramuscularly in the deltoid muscles. And the companies who are providing the Aberrab, RABIES, and Pasteur laboratories. Pregnancy, during pregnancy, it is safe. There is no contraindications. And if you are giving the other regime of prophylaxis, then it is a intradermal injection of rabies. The intramuscular is given in 5 doses, 0, 3, 7, 14, and 28 days. And intradermal, when it is given 2 injections at a time, one on left deltoid, one on right deltoid, 0.1 ml, and a blob should appear in the deltoid. And these are given as 3, 7, and 28 doses, 3 doses only. And whereas there is a reinfection, then you have to give 2 doses of 3rd and 7th day. So this is the very safe method of giving vaccine, and chances of reaction is very, very less. So this is, and now we are going to discuss the main subject, that is the new vaccine. RABIES. The heading is the dose reduction strategy in rabies management, role of novel. The heading under which we'll be studying this is rabies disease, animal bite incidence, epidemiology, evolution of rabies vaccine, challenges, and unmet need. Introducing the rabies, novel technology, clinical study, phase 2, clinical study, phase 3, and takeaways. So these are the headings under which we will be studying the rabies in short. So this is a rabies virus, and you have got this said that it has got various proteins, and this one of this G protein is being used by Cadila to prepare the rabies vaccine, the detail of which we are going to discuss now. Rabies is a zoonotic disease caused by rabies virus encoded by 5 structural proteins. You see, this is a G protein, and there are other 5 structural proteins. And from this, the vaccine is being prepared. Protein is a major antigen in the formation of neutralizing antibodies, NAB, against rabies. Globally, as we have already told you, that 59,000 deaths every year, and in India, they are saying 20,000, but the actual figure is not known. And 90% death is in rural area. Rabies is 100% fatal, but 100% vaccine preventable disease. So if you use the vaccine in proper time and proper doses, then you can prevent the rabies. How this vaccine started, this evolution of the vaccine. So 1885, the live attenuated vaccine is prepared from the spinal cord, and 31 doses were required. 1885. Now 1911, inactivated vaccine from the brain material up to 10%, and there were 14 doses required, each of 0.5 ml. Then in 1976, inactivated vaccine, the cell culture which I was telling you has started about 50 years back, and this is a standardized immunogenicity lyophilized system. 5 injections, 0, 3, 7, 14 and 28 days. What is the current situation? The current rabies vaccine or cell culture vaccine, as you have seen. Inactivated vaccines are 50 years old technology. There is inconsistency in potency, stability, short supply, and adverse events. There is decreased compliance beyond 3 injections. Many of the patients, they do not go for all 5 injections. It is very important. And once they have missed the time of the injection, it will be of no use. So this is non-compliance in major issues. You see, after 3 injections, there is only 47% or 54% compliance in 5 injections. So the compliance in this is very, very irregular and harmful. Non-compliance is a major issue. Decreased compliance beyond 3 injections. Meeting the unmet medical need, introducing a novel vaccine with a simple and short regime. Rabies, the 3-dose vaccine. This is the first protein subunit vaccine prepared by VLP platform technology. First vaccine with 3-dose intramuscular regime, better compliance due to easy flow regime and less visits, and convenience, ready to use injections, no reconstitution needed. So this is RABIES. Now we'll wonder what is VIL technology. So we'll go about this also. This is a native virus, original virus. Then G protein is difficult to stabilize. G protein isolation is very difficult using VLP technology, purified and stabilized by Cadila Pharmaceutical, the only company in the world who has done it. The virus-like particle, that is VLP, what we call virus-like particle, are protein complexes, exit as nanoparticles. VLP are similar to native proteins particle, but they do not contain the viral genomes. They cannot replicate, but mimic the viral antigenicity without being pathogenic. This is very important. They cannot replicate, but can mimic the viral antigenicity without being pathogenic. There is no harm, no damage in this, no fear in this, using this vaccine. They are capable of inducing a strong humoral and cellular immune response. And VLP as vaccines, rabies. Original research article, a novel recombinant rabies vaccine, G protein vaccine, rabies, a VLP-based rabies vaccine, was first prepared by Cadila Lab. The doctors participating were Dr. Sumit Poddar, Dr. Ashok Agrawal, Dr. Amit Soni, and Dr. Seema Sharma. And this has been given in the Journal of APCRI. You can get this. Study is design. Original research article, a novel recombinant rabies G protein vaccine, a VLP based rabies vaccine. This I have already told you, these are the scientists who have worked on this. And the study design 037 and 032 dose and after 3 dose. The vaccine's concentration is seen, and you see in the chart here that phase 2 data for novel rabies vaccine. This is a perfect end to the beginning. You can see from day 14, day 42, day 90, day 180, and day 270, the concentration is maintained. And immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered a simulated post-exposure immunization, a randomized comparator controlled multi-center phase 2 clinical study, human vaccine immunotherapy. To evaluate the immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. The randomized comparative control multi-center study, total 800 subjects were studied, and 533 subjects for rabies virus and 233 for other virus, 267 for other virus. You can say Rabipure, for example. To demonstrate non-inferiority of the test vaccine to comparator vaccine. We'll see in the next slide. Subject is with seroprotection at 14 days level post first dose. Second objective, subject with seroprotection at 42 post first dose of this vaccine, safety by monitoring subjects with adverse events. The result, which I am going to tell you later. Seroprotection, the protection obtained by vaccine is known as seroprotection. Now, these are the outcome. The results were constant across the female and male gender. Observed difference of only 1.52, maximum 4.17 with the specific margin of -4. And you see the chart. This chart, this is the green one is rabies and other one is this, and the various side effects you can see, various effects you can see on this chart. I'll give a minute to study the chart. The green one is rabies, the yellow one is Rabipure. Adverse events, local adverse events, and systemic adverse events. So this is the result. Internet connection टूट गया.
इससे any problem? क्या हुआ सर? All set sir.
आ गया.
Okay.
Rabies was non-inferior to reference vaccine. These are the results. Less adverse effect compared to reference vaccine. And novel 3-dose rabies was found to be safe, immunogenic, and was comparable with 5 doses of WHO pre-qualified vaccine. This is very important. So these are the awards which they got: Pharma Innovation Year by Economic Times, and the Golden Globe Tiger Award by Malaysia for Innovation Product of the Year. Thank you very much.
Thank you, Dr. Dixit. Thank you, sir.
Thank you.
Now, question answer session is started. So मैं मतलब अपने सभी डॉक्टर्स को रिक्वेस्ट करूंगा कि अगर कुछ क्वेरी है या फिर कुछ क्वेश्चन है जिससे आप रेबीज के बारे में जानना चाहें तो आप चैट बॉक्स में इंटर कर सकते हैं. मैं डॉक्टर को दीक्षित सर उनके जवाब देंगे. मैं उनके Sir, main Dr. Bhanu Sahu is asking question regarding what is the difference between 5 dose and 3 days. Because of that, in country at present, 5 dose therapy is there.
Yes, yes. What is your question? Five dose में, as I have told you already, that follow-up is very weak. Some persons are living at 3 doses, some are living at 4 doses. Likewise, when 3 doses are easy and near to each other, so it is easily taken. 0, 3, 7. 5 doses 0, 3, 7, 14, and 28. So this is the difference, that the doses are so near to each other, the person is going to take it. As we expect.
Sir, if patient अगर किसी पेशेंट को अगर मान लो 1 से 2 महीने के अंदर में फिर से डॉग बाइट हो जाता है तो उस कंडीशन में थेरेपीज को फिर से देने की जरूरत पड़ेगी.
उसको 2 डोज फिर से दी जा सकती. 2 डोज देना है, 0 और 7 डेज में.
ओके. और सर व्हाट इज द पेडियाट्रिक यूज फॉर थेरेपीज? डॉक्टर भानु साहू इज आस्किंग.
Yeah. What is the?
Dr. Bhanu Sahu is asking about
Yes.
pediatric dose.
Genetic?
नहीं सर, पेडियाट्रिक बच्चों के लिए यूज के लिए सर.
नहीं, no. This is not being recommended at present below the age of 18 years, but Cadila is preparing it, this dose, from 2 to 18 years, and which will be available after a few months.
Sir, Dr. Agrawal is asking about your clinical experience in rabies cases, sir.
I have seen several cases of rabies in my life, and I don't like to see such cases as such a difficult situation, and the patient in such a severe agony that people start him visiting like as if there is some decision that a man is doing. So my personal experience is that we should be very cautious if the dog bite is there and take all the dose of prophylaxis so that this disease does not come. Once you see it, you will surely much distressed with the scene of a rabies case.
And sir, if sir patient has a multiple bite, then immunoglobulin is required or not?
Yes, immunoglobulin is required in all cases who are having multiple bites and bites near the head. They should be given. First, they should be washed thoroughly with soap and water, because soap disturbs the fatty layer fat of the virus, and then all vaccines should be given this as early as possible. And preferable, you give it this ready-made vaccines, antibodies, mononuclear antibodies, monoclonal antibodies. Older vaccines safety is there, but difficulty is that there is a reaction chances are there by equine vaccine, and human vaccine cannot pass the blood-brain barrier. So if it is slightest delay, it will not be effective.
Sir, it is a ready to use vaccine, sir?
I mean, still ready to use passive vaccines, passive immunization.
Okay. I think, sir, no more question is having, and wait for some time, or sir, conclusion the session, sir.
As you like.
Yes, sir. Sir, thank you very much for your answer, sir. And sir, I would like to introduce my sales manager, Mr. Irfan Ansari, for thanks of and final conclusion, sir. Vote for thanks and final conclusion. Irfan, sir.
हाँ देवेन.
Yes, sir. Sir, vote for final. Yes, sir. Sir, Dikshit sir is.
Sir, thank you very much for wonderful presentation of rabies and
I'm not
deep
seeing your
knowledge
face.
and your
Not seeing-
experience. Sir.
Your face is not being seen.
Yes, sir. Sir, thank you so much, sir, Dr. Dikshit, for the informative talk. We truly appreciate your effort. And last but not the least, we would like to inform you that Travis has won 2 prestigious awards in innovation category, IT India Pharma Award and Golden Global Tiger Award from Malaysia, sir.
Thank you.
Thank you, sir. And thank you very much, Dr. Dikshit, for your valuable time. And I also thankful to all the doctors for in his valuable time. Thank you very much, sir.
Thank you.
तो मीटिंग एंड करना है सर. हेलो दीक्षित सर, डॉक्टर दीक्षित सर.
Yes.
सर ये मीटिंग ओवर करना है.
जब बोलेंगे आप.
करना है तो कर देते हैं सर.
Yes. Yes.
ओके सर. आप निकल जाइए, उसके बाद मैं ओवर कर देता हूँ.
Yes. Yes. I will do it. I will fix the date with Mr. Rajput.